is if the person is not taking enough dietary vitamin K consisting food, and if he or she has any absorption problems, and if they are on broad spectrum antibiotic therapy, that can also affect the vitamin K levels, and use of vitamin K antagonists like warfarin, right? So we will discuss about warfarin in later stage of today's lesson. So what warfarin does is it will antagonize vitamin K, right? So if you use such kind of a drug, vitamin K deficiency can happen through those drugs as well. So vitamin K is available as an oral tablet and an injection. Vitamin K requires bile salts for absorption because vitamin K is lipid soluble. So there are certain vitamins, vitamin K, vitamin A, vitamin D, and vitamin E are water insoluble and lipid soluble vitamins. So when you give vitamins lipid solubles, there should be some some aids for absorption like bile salts naturally. So there should be bile salts available for absorption. So excreted in urine and bile and very little is stored in the body. Clinical uses are prevention of bleeding, and the warfarin antidote from excessive anticoagulation of warfarin. So when warfarin is given, if it is excessive and if the anticoagulation happen excessively than expected, so vitamin K is given as antidote. And in hemorrhagic diseases in the newborn, clinical uses for vitamin K deficiency, uh, these are the names of diseases: obstructive jaundice. Um, so these things, now we discussed about vitamin K. It is not an anticoagulant, actually, it is for coagulation. So vitamin K is required for coagulation, right? But why we discussed that vitamin K is important in coagulation process. So we use some vitamin K antagonists to prevent coagulation, right? So that is why we use this. We discussed vitamin K. So can we summarize vitamin K? So vitamin K occurs we can take it in two forms. One, what is the first one?
Dietary vitamin. Dietary.
Natural vitamin K. And the second one? Yeah, so using gram-positive bacteria, we can synthesize vitamin K, and we use that vitamin K. So how about the absorption of vitamin K? Vitamin K is what sort of compound? Is it water soluble or lipid soluble?
It's a lipid soluble.
It's soluble vitamin. So to absorb that, what we need?
Bile.
Bile salts are required. So vitamin K deficiency can happen due to many reasons. Can you all say certain few reasons how vitamin K deficiency could happen?
Not taking enough vitamin K in diet.
Okay,
Absorption problem.
okay, absorption problems if there are not enough bile salts or liver problems. And the second other one,
Broad spectrum antibiotic.
yeah, broad spectrum antibiotics and
Warfarin use.
warfarin like drugs, vitamin K antagonists. So if there are drugs which can antagonize vitamin K, though vitamin K is present, it will feel as a deficiency. So why vitamin K is important for coagulation? What it assists in the coagulation, respective to coagulation, why it is important? what it does in relation to coagulation, why it is required.
For synthesis of clotting factors,
Yeah, for the synthesis of clotting factors, it is required. Can you all name certain clotting factors? Factor 2, factor 7, uh, 9, and 10. So factor 2 is actually prothrombin. So that is what becomes thrombin. So thrombin is required, right, to convert fibrinogen into fibrin. So if factor 2 is not produced, the fibrin will not form. The clotting will not happen, right? And also factor 7, 10, 9 is also important in coagulation. So the synthesis of those factors, we need vitamin K. And the other thing is for anticoagulant proteins like protein C and S synthesis, we need vitamin K. So that is why vitamin K is important for coagulation. So if vitamin K is not there, coagulation will not happen. So we have to have enough vitamin K there to make sure coagulation happens. So the deficiency, if there is a deficiency can happen if the dietary intake is less, if there's absorption problems, if the patient is on a low spectrum antibiotics, and if they are on vitamin K antagonist. So deficiency could happen. The symptoms, clinical symptom of the vitamin K deficiency is bleeding, right? Okay. Now we are going to talk about the anticoagulant drugs, right? So up to now, we have been discussed about what is hemostasis, what happens in the coagulation process, and vitamin K as external substance to this the coagulation process. Vitamin K is not directly in the process, right? But to happen this cascade of event, vitamin K is important. So that is why we discussed about vitamin K, right? And now we are going to talk about these anticoagulant drugs. So what do you mean by anticoagulant? What does it imply? Anticoagulant. Oh, I can't hear clearly. If you all can message, it's also okay. Some people, when they talk, I can just have an echo and some other noises. I can't hear clearly what you say.
Recording stopped.
yeah, anticoagulants means uh,
I didn't hear you, Miroshi. Yeah, I can hear you, but it's like from a very far end. I can hear your voice in a very low. I can hear Sarah clearly, but other than that, I can't hear anyone else very clearly. It's like you all are from a very far location and very faint voice is coming. So what is coagulation? Coagulation is making a blood clot and uh, getting the bleeding to stop, right? So anticoagulation is this coagulation will not happen. I mean, against the coagulation, right? It will prevent coagulation, prevent formation of blood clot, right? So why we need to prevent the blood clot formation? Now we discussed when there is an injury Okay, the blood will form, the platelets will adhere, fibrin will form, and the blood clot will form, and they will stop the bleeding. So why we need to stop the clotting formation? So that then up to now we discussed about the clotting and how it happens, and so it is an important protective mechanism. So why we need to stop forming blood clots?
To arrest bleeding.
Pardon me?
To arrest bleeding.
To,
Arrest bleeding. Stop bleeding.
yeah, to stop bleeding only the clot will be formed, right?
Yeah.
Clot is formed to stop the bleeding. But now we use medicines to prevent stopping of the bleeding, or like not stopping of the bleeding. Actually, we give drugs to stop the coagulation. Coagulation in the sense formation of these blood clots. Why should we do that?
To
Can you
prevent
all,
heart attacks.
yeah, prevent heart attack in the sense. So what happens
Prevent
is,
formation of thrombus.
yeah, uh, yes, that is blood clot, no thrombus, right? So why the reasons are, normally this process has to happen when there is an injury, right? But we know sometimes when there are diseases like diabetes, okay? So the platelets, there is a tendency of formation of blood clots without an injury. Because when the blood is sticky, when the glucose level is high, the blood becomes sticky, and then the platelets will get together and form these clots, and also then that will stimulate the formation of fibrin, the blood clots will be formed, right? And the other thing is, when person has high cholesterol levels, the cholesterols will be deposited on their blood vessels. So that will narrow their blood vessel, as well as these cholesterol deposits can attract platelets too. So the platelets will go and attach there like they do in a injury, and they, in that also they can form blood clots, right? And also when there is an injury, they form these clots, and sometimes if these clots are not dissolved, or like if these clots are forming unnecessarily, and if they are traveling, thromboembolism, they are traveling through, I mean, if they don't get dissolved and they are travel through the body, through the vessels, if it gets stuck in a small narrow vessel, that can block the blood circulation. So if they block a vessel in the brain, it can cause ischemia to brain, and strokes can be happen. And if it happens in a heart, in the heart attacks are possible. If it is in the lung, that is also dangerous, right? In the kidney, so it can cause damages. If it is in the eye, sorry, if it is in the retina, the retinal vessels, the vision can get affected, right? Because when they are blocked a blood vessel, the circulation will not happen, the pressure through that vessel will develop, and sometimes the small vessels or the capillaries can get ruptured, and there can be damages. So the vision can affect it, right? So we need to prevent that. So that is why we need to use anticoagulants. Otherwise, we don't have to stop the bleeding, no, I mean, stop a process which will stop bleeding, right? We also want stopping bleeding. But why we use this type of drugs is, the reason is the what I discussed and explained. Is that clear?
Yes, miss.
Miss.
Right? Okay. So one drug, the first anticoagulant that we are going to discuss is heparin and heparin derivatives. Right? So initially discovered in the liver and named heparin. So the liver we call hepatic. So hepa, right? This term is connected with liver. So this compound is initially at the very first discovered in the liver. So that is why it is named as heparin. So this is something that we found in our body as well, like insulin or some other hormones. This is not a hormone or an enzyme, but this is some substance or a compound which is present in our body. Commercial products are pig intestine. So this is present in our body, but commercially we use heparin extracted from beef lung or pig intestine. So heparin, we have unfractionated heparin known as UHF. Heparin derivatives called low molecular weight heparins and fondaparins are a family of sulfated glycosaminoglycans, right? So this is a name. Just you don't have to worry about these names. But only thing is we have heparin in different forms. One is unfractionated heparin, UHF. So it is heparin as it is extracted. And we have derivatives, heparin derivatives called low molecular weight heparins. So they bind to antithrombin 3. They bind to antithrombin 3 and accelerate the rate at which antithrombin inhibits the coagulation proteases. Heparin act in a catalytic fashion by binding to antithrombin and protease complex, then dissociate from the complex and catalyze other antithrombin molecules. Right? I will explain it later, right? We just read through this session and we will explain. So unfractionated heparin is now reserved for patients with renal failure. High doses of heparin can interfere with platelet aggregation and prolong bleeding. Therefore, need to monitor prothrombin time. Activated partial thromboplastin time. Heparin is a drug of choice for anticoagulation in pregnancy because it does not cross the placenta. So heparin source biological, everything is biological, but fondaparin's is some synthetic derivative of heparin. So molecular weight, this is high molecular weight, this is low, this is even low. Target is factor 10 and factor 2A, and here factor 10A and 2A as well. And fondaparin's target is factor 10A. Half-life is higher with the synthetic one. Renal excretion happens in low molecular weight, and fondaparin's may accumulate in renal impairment and cause bleeding, contraindicated in renal failure. But unfractionated heparin is not excreted through renal system. Therefore, we can use it even for a renal failure patient. Antidote is complete 1% solution of protamine sulfate, partial and none. So antidote in the sense if it gets overdosed, we can have excessive anticoagulation and bleeding can happen. For that, we can use for unfractionated heparin protamine sulfate as antidote. Administration continuous infusion or intermittent infusion every 4 to 6 hours. Low molecular weight subcutaneous injection, therefore it can be given even at home. Unfractionated, we can't give it at home because 4 to 6 hours it has to give as a continuous infusion or intermittent infusion. Fondaparinux is also subcutaneous, therefore can given at home. So low molecular weight heparins, we have different types: enoxaparin, deltaparin, tinzaparin. Given subcutaneous, have predictable anticoagulant activity and has no effect on platelets, are longer acting and do not need routine blood monitoring except in obese patients and children. Low molecular weight heparin and fondaparins are more convenient to use and patient can be taught how to inject at home. Clinical uses are used to initiate treatment of venous thrombosis and pulmonary embolism to prevent thrombosis because of their rapid onset of action. Venous thrombosis means blood clots are in the veins. Pulmonary embolism means clots are traveling and it is in the lungs, right? They can also be used in the initial management of patients with unstable angina and acute myocardial infarction. Warfarin is also started at the same time but will take at least 5 days to desired therapeutic levels. Therefore, warfarin and heparin overlap will continue for about 4 to 5 days, right? Because warfarin to act, it will take 4 to 5 days. So we can give heparin and warfarin combination therapy for 4 to 5 days. So what is the toxicity and adverse effects? Bleeding with IV heparin, less with low molecular weight. In those with recent surgery, trauma, peptic ulcer, platelet dysfunction. If bleeding is life-threatening, heparin effects can be reversed by administering IV protamine sulfate. The excessive dose will result in anticoagulation as protamine interacts with platelets and fibrinogen. So whatever, we can use protamine sulfate as antidote. And heparin-induced thrombocytopenia could happen. Platelet count less than 350,000 per ml or 50% drop from baseline occurs, usually 5 to 10 days after start of treatment, seen in females and males. Females is more than males. Osteoporosis can happen. The risk is less with low molecular and fondaparinux. Heparin can inhibit the synthesis of aldosterone and occasionally can cause hyperkalemia. Alright, so if we can summarize heparin, can you all say one by one whatever comes to your mind when we say heparin? Can you all type or like share what you know about heparin? Anything. You can also type.
Heparin prevent blood clotting.
Okay. Anything else? So what else? Others also can join. Hmm? Okay, we got a message. Biological and synthesis type. Okay. Heparin is good for pregnant mothers. We can't say heparin is good for pregnant mothers. Can you word it properly? So when you say heparin is good for pregnant mothers, It sounds like when someone gets pregnant, we should give heparin. Is that what you want to mean? You all have to speak up, please.
Doesn't cross the placenta.
Yes, they don't cross the placenta, but the answer should be if we want to use an anticoagulant for a pregnant mother. If there is a need to use anticoagulant in a pregnant mother, heparin can be used because it does not cross the placenta, right? So you can't say just like heparin is good for pregnant mothers because once you get pregnant, once someone gets pregnant, it is not something like you give a vitamin or like calcium, right? So there are certain drugs, no, when somebody is getting pregnant, there are certain things that they give. Iron is given, calcium is given, vitamins are given because they are good. They are required. But heparin is nothing like that, right? So if there is a need of anticoagulant when someone is pregnant, heparin is a good choice because it does not cross the placenta. That means it does not affect the baby or the fetus, right? Okay, so heparin, Sarah said heparin will stop coagulation, and then Jayani said there are different types, natural and synthetic, right? What are the natural ones and what are the synthetic ones? Can you name the synthetic heparin derivative?
Fondaparinus,
Hondaparinux, right? Okay, so what else about heparin?
heparin and
Heparin can be used in pregnant mothers if it is required because it does not cross the placenta. What else?
antidote for heparin is protamine sulfate.
Yeah, antidote for heparin is protamine sulfate. Then heparin has different versions like heparin acetate, unfractionated heparins, and then
Low molecular
low
weight
molecular
heparin.
weight heparin and fondaparinux,
Mhm.
right? So which one can be used in renal failure?
Renal failure, unfractionated heparin.
Yeah, unfractionated heparin can be used in renal failure. Why?
Uh,
Namindu, Jayani, Janani, who else is here?
There's no renal excretion.
Huh?
There's no renal excretion.
Yeah, unfractionated heparin will not excrete through the renal system or kidneys, through kidneys. Therefore, if there is a failure in renal system, they will not accumulate, right? If it is excreting through the renal system, what will happen is when there is a failure in the renal system, the drug will accumulate and give more and more anticoagulation, which can be harmful, right? So the bleeding can happen and then it can be harmful. But unfractionated heparin does not excrete through the kidneys. Therefore, in renal failure, it can be used without any harm, right? But low molecular weight and fondaparinux is excreting through kidneys. Therefore, in renal failure, we have to cautiously think about it and adjust dose or whatever, right? So heparins can, in high doses, can interfere with platelet aggregation and prolong bleeding also, right? Therefore, activated partial thrombin time or the APTT should be monitored if heparins are used in high doses. So heparin is the drug of choice, right? Heparin is the drug of choice in pregnancy for anticoagulation because it does not cross the placenta, right? So can we now discuss the mechanism of action of heparin? Okay. I hope you can see my whiteboard now.
Yes, miss.
Okay. So we know when there is a injury and when there is a bleeding. So let's say this is bleeding, right? So this process happens. In this process, coagulation, thrombin will convert fibrinogen into fibrin, right? So, as in other processes as well, when we have something in our body, there is always a regulatory mechanism to stop or reduce that, right? If you can remember, when neurotransmitters are released, there is a process to reuptake or destroy them, right? Likewise, when there is these things happening, there are mechanisms to regulate or stop these things as well. Otherwise, this will happen forever and clots will form and that can be dangerous, right? So one of the control mechanism, one of the main control mechanism is antithrombin. Antithrombin, right? So antithrombin will inhibit thrombin, right? So when thrombin is inhibited, what happens?
Fibrinogen won't turn into fibrin.
Yeah, fibrinogen will not convert to fibrin, right? So it will get reduced. So when more and more antithrombin is inhibiting thrombin, this process will inhibited, right? So what these right? So this is the natural pathway. So when thrombin forms fibrin from fibrinogen, and after some times antithrombin will activated and inhibit thrombin. But what heparin does is heparin will heparin will stimulate or they will promote the action of antithrombin, right? So once antithrombin is activated or stimulated, it will inhibit thrombin, and then thrombin inhibition will stop conversion of fibrinogen into fibrin, right? So is that clear to you, the mechanism?
Yes, miss.
Right, so if I explain it to you again, in the coagulation cascade, in the end, Fibrinogen, which is present as a soluble compound in the blood, will convert to fibrin when thrombin is there, right? So as a regulatory mechanism, we have antithrombin, which will inhibit thrombin. So when thrombin is inhibited, fibrinogen will not convert to fibrin. So heparin, what heparin does is it will stimulate the action of antithrombin. It will promote the action of antithrombin. So thrombin will be inhibited. So this process will stop. Fibrinogen will not convert to fibrin. So coagulation will get affected. Right? Yeah, so this is the mechanism. So heparin is also biologically present in our body. So it is found initially at the very beginning in our liver. That is why it is called heparin. But commercially we use beef and pig extracted heparin as drugs. Right? So are you all clear with the mechanism?
Yes, miss.
Okay.
Yes, miss.
Right. So first thing is heparin present in our body, basically in liver. So we have unfractionated heparin, low molecular weight heparin, and fondaparin's, which is synthetic one. And what else about heparin mechanism? It stimulates the action of antithrombin, drug of choice for pregnant mothers. Why?
It does not close the placenta.
Yes. And unfractionated one can be used to renal failure patients. And then high doses can stimulate platelet aggregation. Therefore, we need to monitor the APTT
APTT.
time. Right? And antidote is protease. What is it? Sulfate. Protamine
Protamine
sulfate.
sulfate.
Protamine sulfate. And what else? Yeah, that is basically about heparin. The other thing is heparin unfractionated is given as infusions and 4 to 6 hourly, but low molecular weight and fondaparin's can be given as subcutaneous in when they are at home. Yeah. What else? What else can you all remember about heparin? Okay, we will move to our note again. Right? Okay. So now what we are going to do is like when you say low molecular weight heparin also, there are different drugs. Enoxaparin, deltaparin, tenzaparin. So there are different drugs. So what I want you to do now is a summary of heparin, like what we did now. What is heparin? What is its mechanism? Where it is found? What are the types and examples? And the main things like it is the drug of choice for pregnancy and why? What is the reason? So summary, not more than a page, right? First, you have to do your summary and then go through the drugs. For example, unfractionated heparin and then these three drugs. Yeah. These drugs and fondafalins. You all can go through the doses and contraindications and any special instructions. First, I need the summary 1 page. Are you all clear about what is heparin, what are the types, where you find it, and what are the important facts about heparin, like it can be used in pregnancy, drug of choice, unfractionated can be used in renal failure, because the reason is also should be there because it does not excrete through the kidneys, the antidote, and those things you should write first in a 1 page, and then go to each drug and find the doses and then the contraindications and side effects. And if there is any special instructions, you should write that. Are you all clear? Hello?
Yes, miss.
Okay, so I will give you like a half an hour so you all can do that.